You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Troy Bannister, who is the founder and CEO of Particle Health. Welcome to the show, Troy.
Thank you for having me.
It is good to have you here. And we were just laughing. I think I'm just as excited as maybe you are to talk about data today.
Yeah, there's a lot to it.
There is so much happening. So let's just start off telling our audience a little bit about who you are and what you've been innovating these days.
Yeah, I think the quick summary is I've been in healthcare my whole life. I was an EMT back in high school and college. Ended up going to medical school for a couple of years and ended up dropping out. Got a master's in biophysics and physiology. Took that and I did clinical research for a few years and then was in venture capital before starting Particle. And I think that journey, seeing the healthcare system from very different angles, produced a pretty clear thesis in my head, which was nobody has access to medical histories on patients in a very effective way. Whether I was in the ambulance or the hospital or doing research or working with entrepreneurs building healthcare companies, nobody had good access to healthcare data on patients. And so when I looked around, I saw companies like Plaid and Stripe and Twilio, if you're familiar with any of these companies, and they were solving similar problems in different industries. And so I thought, why is this model not applicable to healthcare? And so I jumped in relatively naively back in the day and started Particle without knowing much. But we've been lucky and have been able to build something that is very different than those, but solves the same problem, which is just with somebody's name, date of birth, address, and phone number, we can go collect all of your medical records around the country digitally in under a minute. And clean and process and standardize that data for use in applications, websites, at the point of care, EMRs, whatever.
So how is this possible where we have been talking about data and interoperability for, I don't know, probably two decades now? Certainly a hot topic at some of the recent conferences that we've been to. We were talking about how there was a whole stage at Vive a few weeks ago that was completely dedicated to this. And so, in some ways, we're having the same conversation that we were 10 years ago, maybe some different angles, some different government initiatives that are driving change. But, just kind of give us your take on where we are today and maybe some of the tailwinds and headwinds that are kind of shaping what's happening around healthcare data.
Yeah. The way I see it, there's been an evolution of attempts that's trying to solve this problem. The old school, still number one way medical records are exchanged today is the fax machine. And there are companies out there that are doing hundreds of millions of faxes a year for things like risk adjustment and, payer related things. That's still the number one way. The next kind of bucket of attempts I call integration engines. And these are groups that give you tools to connect to a hospital, for example. And that doesn't solve the entire healthcare system connecting and sharing data, but it does solve one-to-one very well. And there's some companies that do a really good job at this one-to-one problem. The next bucket I refer to as portal scrapers. This is where you use like your username and your password to log into multiple different portals, and then it brings all that information together. And that there's a couple companies out there trying that attempt. The newest attempt is what people refer to as networks of networks. And so when you talk about tailwinds and regulatory pushes, there's been two really large initiatives from the government. One is stemming from the 21st Century Cures Act, which was Obama's last act before he left office. There's a rule within the 21st Century Cures Act called the Anti-Information Blocking Rule. And like it sounds, it points a finger directly at the organizations that have patient data, like EMRs and hospitals and labs and pharmacies. And it basically says you're not allowed to block access anymore. It used to be that you can pick and choose who you share data with. That doesn't exist anymore. You have to open up access to organizations and individuals that have the right to access it. And they call out providers and patients and some other stakeholders as those groups that have the right to access that data. So now that that rule's in place, groups like Particle can go to the EMRs, plug into them. And on the other side of Particle, we have, for example, providers or individuals requesting their own records or requesting records for on behalf of patients. And so they can't say no anymore. That's the big difference, is there's no legal grounds to block access to information. So in relatively quick order, we've been able to plug into basically every EMR and health information network in the United States and build one single platform, one contract, one API, and one data standard around that.
So why do we still have some people that seem to be struggling to connect with EMR systems or struggling to aggregate data sets? What's still some of those barriers that people are still trying to overcome? And, again, kind of what are you doing that's different?
This new regulation is relatively new, right? So like what Particle does today was not possible like 3 years ago.
Gotcha.
And so the companies that work with Particle, and these are big companies like Oak Street Health, just got bought by, I think, CVS. They're using Particle, and they've been using Particle for years, and they have full longitudinal histories of every patient that walks in through the door there within a minute. And so they're able to do things like risk management and risk stratification and suspecting digitally in an automated way. And they don't have to do chart chasing, and they don't have to do all these manual processes through fax machine that cost so much money and waste so much time. These are the first adopters. We're still in like the first couple innings right now. I bet you in 2 years and 3 years, that conversation, that statement, why are people having trouble, it will not exist anymore.
Okay. So we will not need to use taglines that are like, liberate the data will finally be liberated.
It's happening.
Yep. Okay. And so is this taken into consideration? So kind of like some of the examples that you were talking about, where you might have a specific health system or EMR where they're doing that one-to-one and kind of trying to bridge within a single ecosystem, aggregating and standardizing their data. And I've always thought, okay, even if they achieve the holy grail of interoperability within their ecosystem, how does that still really solve the problem? Especially what's happening right now, younger generations using telehealth, using urgent clinics, the sites of care is changing. And these are sites of care that those institutions don't necessarily own or have access to. So is that something that you're also solving for, is when you've got these younger generations or older that are just using new channels of care like text, telehealth, primary care clinics that are going to be launching from Walmart? Is that something that's also being aggregated into a single data record?
That is exactly what we focus on. So what we don't do is go to like a big hospital system and say, hey, you've got clinics over here and you've got labs over here, and they're all within your system, but you need to get them clean and connected and standardized. That is not what Particle does.
Right.
What Particle does is we work with, as you mentioned, these virtual first solutions primarily, and we get all the healthcare system data into their system. So these kind of, new, there have been, as I'm sure you're aware, there's been so many new startups and digital solutions that have popped up over the last, like tens of thousands.
Yes.
They're just silos floating on islands out there. We need to connect them to the healthcare systems, right? If a patient goes and has a really important encounter virtually, that should make its way back to the EMR. And then the EMR information should make its back to the virtual provider as well. So we facilitate that sort of outside of the bounds of the traditional healthcare system connectivity. And we're bidirectional in nature. So the data goes back and forth through Particle.
So who are your ideal buyers?
So the typical customer that we work with is in some way or fashion managing risk. So fee for service companies don't necessarily care so much about the data, right? I have a rash, here's a prescription for an ointment, let me know if it comes back. And then they get paid for that transaction. It's very transactional. We care more about the value-based care and risk management types of companies. That's where we see the most value. They also have to be able to like ingest and work with an API, meaning we get a lot of data. We have a 90% success rate in finding patient records, and we find about 160 records per patient per search. And so 160 records for a doctor to look at within a 10-minute virtual consult, not helpful.
Yep.
So we have tools and we've got data products and analytics and stuff, but you have to be able to take that data and get it into your workflow in an effective and valuable way. So you have to have some sort of, sophistication around data as a core, value proposition internally. Other than that, we work with a huge variety of customers. end-stage renal disease, diabetes, cancer, pharmacy, med reconciliation, just primary care, you name it. We work with every specialty you could imagine, but they need the data to manage risk better. And that's where we come in.
So when I think of, a lot of the folks that are in our audience that are innovators, at least 50% are early stage innovators. It sounds like this is something that really almost all of them need, because no matter what type of care that they're providing, they're going to want to integrate into a workflow somewhere. They're going to want their data to be integrated into the holistic ecosystem. And that's going to be, at some point will be table stakes. Like it'll just be a requirement in order for you to be able to deliver care. Otherwise, like you said, we've got hundreds of thousands of innovators that are maybe bringing some pretty cool stuff to market that solves really important problems. But if it's siloed, then how beneficial is it really going to be?
That's exactly it. I mean, if anybody needs to understand a patient history to treat them better, that's where we come in. And there are dozens of organizations building their businesses off of this data today on top of Particle. And that was the whole dream, right? When I started this company was, the real hypothesis is if you're familiar with the company Plaid, which some people are not familiar with, they're the company that connects all the banks together in a digital way. Venmo would not exist without Plaid. And people don't really recognize that concept. Right? There's an infrastructure behind Venmo that allows you to send $5 from your bank account to your friend's bank account. Venmo did not build that infrastructure. They're using Plaid to do it. So in the same way, what can be built on top of Particle in the healthcare context? And that's where we're seeing some really interesting innovations happen on top of our data.
So what are some of those things? Give us a couple of examples of things that are really, really exciting that's happening.
So obviously there's a lot of talk around AI, and we're seeing some wild stuff on top of AI. I mentioned, we can find, 160 records per patient per search, and that's not very valuable to a clinician, but that's very valuable to an AI service, right? You can just ask it, what diseases does this patient look to be at risk for? And the AI can produce a list of this from, most probable to least probable, or something along those lines. There's AI that is doing suspecting on patient records, meaning they don't have a diagnosis for something, but there's some things that indicate they might, and maybe we should look into those conditions. So there's this whole world of AI that's, I think, being built on top of Particle today that's really compelling and interesting. Another one is clinician workflow tools. So, one example is we're working with Clover Health, which is a big Medicare Advantage plan. They've introduced this kind of provider tool that will pop up in the workflow and say, hey, I'm going to nudge you. This patient has not had their eye exam this year, and they need an eye exam. And we were able to identify that they haven't had it through Particle because we can see their history. Or they have had an eye exam. You don't have to do it, right? Here's the eye exam results. Don't waste your time doing it twice. So there's some really interesting stuff happening on that side too.
Well, you bring up a really good point, because, we've got a lot of hype around the intelligence revolution and all of the different use cases for AI in healthcare. And that is all contingent upon data. And so we have to be able to have data in order to make those machines learn and be able to accomplish the things that they've set out to do. So what are some of the gaps that are happening right now when you aren't having your tools like yours in place?
Well, I mean, the biggest competitor we have is the fax machine. That's our biggest competitor today. And if you go to our website, we have all this stuff around destroy the fax machine. It's kind of our internal motto.
So whenever we're, doing our post-production on this episode, we're always looking for the power clips and kind of a quote from our guest. That's the quote, right? Our biggest competitor is the fax machine. I love it.
It's true.
And it's true. It's so sad.
There are these companies that are doing literally hundreds of millions of paper faxes a year. It's unbelievable. So that is a reality. And so that's what we're up against, right? So when we talk to these customers, we're talking about how many faxes can I reduce in my workflow, and how much faster can I get this information, and how much more comprehensive is it? Because we're waiting weeks sometimes to get this information. and that's just delaying treatment. We are working with a customer that specializes in kind of rare cancers. And we were able to increase their treatment plan enrollment by 50% because you have to qualify for some of these treatment plans. And without the data to allow you to qualify, you can't get into these programs. These are advanced aggressive cancers that are killing people very quickly. And so like the ability to enroll somebody in a treatment plan is critical to their outcomes. And the fact that we can enroll people 50% more is just like exactly why we started this company.
We have a huge engagement and adoption problem. You know, I often say we don't really need more innovation. We just need more people using a lot of the innovation that's already in the marketplace. So that's really interesting.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
So as you think about your own commercialization journey, when you decided that you had this idea that you're going to launch this company, just kind of walk us through, share some of the good, the bad, and the ugly of what it's been like for you as a founder and a CEO, some of the lessons that you've learned along the way, things that have been maybe really aha, exciting, completely unexpected, and maybe some things that have been real difficult challenges for you as you've gone through.
I think the hard milestone to achieve for everybody is finding product market fit. And you don't really know exactly what that looks like, right? There is no standard definition of product market fit. You kind of just know it when you see it. There just happens to be that day when the usage chart starts to hockey stick up, right? And people start really using the heck out of your product, and word of mouth and your reputation starts to get back to you as a positive and good product in the market. I think you have to just keep your heads down and just keep pushing. You gotta always be hypothesizing what is product market fit and how do I get it. But the biggest lesson is persistence. You just gotta every day wake up and be optimistic and keep pushing forward. It always takes longer than you think. We're not building Tinder. This is not a viral app that explodes overnight. This is in healthcare in particular. And Bessemer just came out with a really interesting report on how long it takes to build a healthcare company compared to general, SaaS and cloud offerings. It's longer. It takes longer to do it. This is a difficult space to go build into and sell into, particularly if you sell to hospital systems, right? 18 months sales cycles, nonsensical purchasing decisions. Just be ready for the marathon, right? It's painful. And that's what you sign up for. And you just have to be comfortable with that. I think commercialization wise, you got to find your super user customer first. There's always that first adopter that is willing to try. You got to find the right group. And sometimes it takes you a couple tries to find the right group. But they will be the ones that are, proactively giving you feedback. They will be hopping on more calls than they have time to do. They're vested in the success of what you're trying to build. We were lucky to find a customer that needed to build interoperability into their solution. And they made a bet early on that somebody else would do it. And that was a perfect fit for us, right? They said, let's not invest millions of dollars in building a team to building our own interoperability solution they were $1 billion business. Let's wait until somebody does it and focuses on it and does it better than we do. And we found that group, and they made that bet. They found us, we found them, and we were able to be that vendor and build for them. And over the years, we've built kind of congruently with what they needed. They haven't been our only North Star, but they've been one of our data points that have created a North Star for us.
It's
and really,
critical.
yeah.
Yeah,
So
I
we
mean, what you're
find
describing is the characteristics of an early adopter. And like you said, they aren't expecting a perfect product. They kind of want to tinker around with you. They really want, that's part of what they get out of that relationship, is being part of that, not necessarily from scratch, right? You're not necessarily, let's put the wheels on the car, but once you've got the foundation, that they're helping you to refine and finesse what that will look like in the marketplace.
totally. You have to find it. That's maybe the most important part.
So just curious, one of the questions that I'm asked all the time is, okay, I hear what you're saying about how I have to find my early adopters first, but where do I find them? So how did they find you? How did you find them?
I think it was just trial and error. Like I said, I think we had our first paying customer did not end up being like our ideal customer profile or our kind of guiding star. It was like, I think, our third customer. And at that point, we had a working product. We had a little bit of revenue, not a lot. And we were basically giving the product away for, I'd say, 10% of what we're charging now. Very, very cheap, right? And that was kind of, I think, the first wedge was, we're going to get something that is relatively obvious in terms of ROI for you, but non-obvious in terms of clarity around what this thing will be in the next couple of years. So the ask was, we will, in exchange of giving you this ROI for really, really good price, you will help us guide that clarity towards what we should be building and how we should be building it. And so we had really good partnership there, and that company actually ended up investing in us as well. So we have a very strong bond with that organization.
And that is a strategic partnership around pre-launch and launch that is a game changer with scalability.
Totally.
That's the holy grail, Troy. You got it.
Yeah. That's you got to set those things up.
Not only the customer, but also the factor.
It's like, how do you game the system for yourself is the kind of trick, right? You got to find the right people and give them the right incentives and line everything up, and you'll get what you need if you can game it.
So I remember when we were kind of just going back and forth with prepping for our session today, and I had asked, what's the one problem that you're looking to solve in the next 90 days? And your response was, this is healthcare. And so that ties to, what you're talking about also is just the pace and the speed. But it sounds like your business model and your products that you're bringing to market, even though you still might be facing some of those more traditional obstacles that are in the healthcare ecosystem, that because you aren't having to deploy some of the old ways of interoperability, that you're actually able to make progress and start to see a lot more commercial success faster.
Yeah. So what we say internally is, we're not a healthcare company that just happens to be in technology. We're a technology company that just happens to be in healthcare. And that type of thinking means API mentality first, high margins. The API should interact like a Google product, not like an Optum product, right? How can we be a technology first company in healthcare and not the other way around? Of course, healthcare is critical and core to what we do. We've got an MD on staff, and we have to think about use cases and value props and privacy and HIPAA and all these things, of course. But the mentality that we have to pursue is, this is a scaling tech company, not a healthcare services company. So to your point, the product itself is infinitely scalable. We don't need any services at all. You take the API, you plug it into your EMR or whatever you use, and you're off to the races. And then as you grow and as your company, our customers grow, our usage grows and we get more money, since we charge on consumption through the API. So the real key to it is, how do we get people excited, onboarded, and then have a roadmap for them to grow in usage and grow in use cases and get more value from the product itself over time. And we've been pretty successful in this kind of land and expand motion.
So help me, so that's really helpful. So help me understand, where are you? Maybe you're doing this now, but when I think about the future of where we're going, from a data standpoint, we are not just patients, right? We are people, and there's so many different aspects to our life. So also, in addition to all of these different new sites of care that can be aggregated into a central record, we also have insights like social determinants of health. We just even consumer behavior. So how close or far are we from really being able to have a more holistic view of patients that or people that are kind of integrating consumer data with healthcare data to help us really be able to leverage things like AI and being able to understand the context better?
You're speaking my language. There's 3 strategies at Particle. One is data acquisition, and we want to build the most holistic picture of a patient we can. So today we've got EMR data, we've got pharmacy data, and we've got ADT feeds for alerting, admission, discharge, transfer, notifications.
Yep.
We're now looking at social determinants of health, IoT, genomics, claims, and then there's a big list that we have. We want to integrate all those data sources together to one record. So that's strategy 1. Strategy 2 is then taking all that data and creating unique insights from it. And so analytics, AI, ML, whatever you want to call it, producing some novel type of important action-oriented insight. And then the last one is, how do we get those insights to the people that need them? There's the API version that we offer now. We're also looking at things like SDKs and iframes and widgets and applications. What are other more creative ways of getting these insights into the place where the person needs it? So that's what we're doing. In terms of consumer and all these other things, that is absolutely part of our data acquisition strategy. We have to go collect and aggregate a much more comprehensive picture of a person, because that one dimension of clinical data is not enough to really
it's
drive
a huge
the point.
start, but yeah.
Yep.
So let's, talk about the patient or consumer for just a second. Anytime we're talking about data and interoperability, the conversation always comes around like privacy, and, the use of data. And so, just share some of the thoughts that you have around, in addition to being able to have access to these larger data sets and for providers to be more tuned in to the holistic view of consumers. What does that mean from a privacy standpoint? And what does that mean from, I'm a consumer and I want to be the owner of my data and have control?
So there's 2 buckets here. One is sharing data under the premise of HIPAA. In that category, of course, people don't always realize, but the P in HIPAA stands for portability, not for privacy. There's a separate act called the HIPAA Privacy Act, and it's a very different set of rules. The P stands for portability. And what HIPAA really intended to do was allow patients, providers, and payers to exchange data in safe and non-friction filled ways.
Yep.
It ended up kind of turning into something way more complicated than that, as we all know. But that was the intent, was a doctor has a right to grab your medical record if you're in the ER without any friction at all. And a payer can see some of your medical data, not all of it, in order to get a payment complete. So you're not sitting around on a reimbursement. There's all these, this is what HIPAA was meant for. So in those use cases, we facilitate HIPAA. That's what Particle does. Yep. If you are going to a doctor's office, you'll sign an authorization form. And then with that permission, we will automatically pull your record right into the EMR. One Medical is a customer of ours, for example. And so it depends where you go, but you may not have to fill out any forms when you walk into One Medical anymore. We will automate that form filling.
That seems like a dream, Troy.
Allergies, meds, prescription, it's all just automatic. So you don't have to fill anything out, you just walk in. And so that type of HIPAA related data exchange is something we already facilitate today. The other side of it is, I as a consumer have the right to share my data and have access to my data and share it with any third party of my choosing. Legally, you have the right to do this, right? It's your data. If you sign up for a life insurance policy and they need your medical records, by your own control, you should be able to click a button and just have that done, right? That's not how it works today. Today, you have to go fax for it and get all these stuff done. So that's the second kind of build that Particle has already built out. And this is the consumer mediated data exchange side. We partnered with Clear. You might know Clear, like in the airport. And so with a picture of your face and a picture of your driver's license embedded in any workflow, like at a life insurance company, you can now share your records directly into that workflow. And that might mean, hey, I'm signing up for 23andMe and I want to get insights on my genomics, but I also want the context of my medical history to be overlapped in that. And so like, that's another example of something we want to do. So that's where I think the future is.
Yeah.
And that also allows you to log into Particle and say, oh, I've given permission to 6 people in the last year, and I want to revoke access to some of them. Or I only want some of them to have a partial access or a limited amount of access. So that control of really forcing HIPAA digitally is where I think the future is coming.
So I know that you were demoing this at the Vive conference.
Yeah.
So what were some of the reactions that were happening?
This is my favorite part of Particle Health, and it's been the response for years is, I don't believe you. It's my favorite thing people say. So we were successful. We had, I think, over 100+ folks sign up for, we're running an alpha program.
Okay.
And this is where it gets a little interesting. The alpha program is meant to create an index of who's responding to you requesting your own record and who's not responding. It is now illegal not to respond to you requesting your own record based on the information blocking rule. So over the course of the next couple of months, we are allowing consumers and interested individuals to just request their own records and see if your doctors are responding to your own requests or not. We're going to build that index out and see who's following the law and who's not following the law. And so that is happening right now. We're building that index out.
That's exciting. That's what I said, you know what? I'm probably going to be just as excited talking about this, geeking out on this data conversation as you are. Maybe not much, but pretty darn excited.
It comes down to patient rights. You have the right to access your data. Why can't you do it? It blows my mind.
So do you envision that consumers all over will have a Particle account, no different than the providers, and that we will be, you know, just like I'm logging in to check my credit report and making those determinations of who gets access to my data, but I own it.
I think Particle will be largely invisible, right? So any application you download, right? Any application you download from the App Store that uses Particle will instantly be able to access, and you will instantly be able to revoke access to your data.
So what's the interface then that I'm going to have on my phone? Is that yet not to be discovered?
So that's what our customers would be, right? Our customers would build things on top of our data. And so, you know, when Plaid started, there was no such thing as cryptocurrency. Didn't exist. And now cryptocurrency is like this giant thing that in the US, at least, is built on top of Plaid. So what's going to happen in healthcare when this is real? Right? What innovations will people come up with that leverage your medical histories? Is it finding the best provider based on your medical history in your neighborhood? Is it helping you select the best insurance plan at the lowest cost based on your medical history? Is it getting cash back from, you know, your life insurance company or your insurance company for demonstrating healthy behaviors or dropping your A1Cs? There's so many. I mean, I don't spend a lot of time thinking about these things because I'm so focused on the data. But there is a whole world of unlocked innovation where people have not historically been able to build things for consumers in healthcare. People have historically built things for payers and providers because that's who has the control. Now, if we take that control away and give it to you, the consumer, people are going to build new things. And in the same way, like all these banks built money sharing things from bank to bank, but nobody used them. As soon as Plaid popped up, Venmo came to the table, and everybody uses Venmo now because it was built for the consumer. It wasn't built for the bank. And so I think that's going to be the mindset shift that happens over the next couple of years. And that's what I'm so excited about.
What a fun and exciting ride. And in many ways, you've accomplished some incredible milestones. And also at the same time, what I hear is you're just getting started. You're just scratching the surface. There's a lot more to come.
This is a long haul startup. We're first to the table as the regulations change. So there's a lot of uncertainty. That cone of uncertainty is quite broad. But it's not an if, it's a when now, right? And so it's not if these regulations open, it's when these regulations open. And so that's the thing that we're able to capitalize on and be first to the table with. And there's a lot of regulatory maturity that's coming down the road over the next couple of years. So that's where innovation starts to spike, I think.
So for all of those folks in our audience that maybe are struggling with their own ideas and business models, think about what you said today and how they might unlock that in their own application, how that might change their business models.
Absolutely. There's a lot you can do with this data.
So Troy, thank you so much for joining me today. How can folks get a hold of you at the end if they want to follow up with you to learn more?
I think the best thing is reach out to me on LinkedIn. Just shoot me a message, and that's usually the best place. My inbox is a disaster in email. And so if you shoot me at LinkedIn, that's the best place for me to grab it.
Awesome. Thank you so much for joining me today.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.